Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
Does your diagnosis actually not help you, telling you what you need to do? Are you scared because you're not sure on how to manage your own symptoms? Well, that's why you're here today. We are going to discuss long-term situations that perhaps you're getting symptoms that you need help with. And we're going to try and guide you through a holistic plethora of different things that you can do. We have today, our guest is Regina. She's back again. It'll be part 2. Last week, Regina had been I had noticed an immunity disorder, and we discussed it. However, because of her immunity disorder, I kind of bypassed a lot of her smaller symptoms and things happening in her body. So I didn't mark all that down for her. And I just feel that we should give her that information, and perhaps it'll help her manage her symptoms, and maybe she can even discuss it with her medical practitioner of her choice so that she can get further help on that situation. By the way, hello, I'm Dr. Gloria C. Warren, host of Medical Intuitive Insights. If you're here for a reason, and perhaps we can help you with something. So our topic today is sound frequencies to heal. So that doesn't mean that's all we're going to talk about, but that is a topic that we are going to delve more deeply into. So we're also to provide further insights in the pros and cons of sound frequencies, along with any comments or anything that Regina may have. Remember, though, today you are the star of the show, as well as Regina, of course. And if you have any, have any comments or questions, you can definitely contact us. So what are the possibilities for your diagnosis? In her case, autoimmune disorders, and a resolution for that would be really well stated. We did discuss that last week. Regina, are you there?
Yes, I am.
Okay, Regina chose today not to show her face, and that's fine. We do that for our patients if that's what they wish. So Regina, thank you so much for being on our show. We're going to try and assist you and our viewers as well. And last week we went through autoimmune disorder and potentials and possibilities for you to negate some of those symptoms and help to bring you back to normal. Regina's situation appeared to be more of a pH level situation, and her body being very acidic. When your body's too acidic, and this scientific research has confirmed this, when your body is too acidic, your body can actually attack some of its own cells, and that's a type of immunity disorder. It can attack blood cells, change blood cells, lower blood cells. It can attack bones and joints. And so I'm sure, Regina, you probably are getting some of those symptoms. Regina, I'm just going to go over the process that we went through last week for them. And the process being a medical intuitive reading here only is 10 or 15 minutes. But unusual time, it's 1 to 2 hours, sometimes 2 to 3 hours, depending. And if I'm reviewing an environment as well, like their home and everything in their environment, looking for chemicals, that's another added time of undisclosed amount, depending on how much I review. So today we're going to do sound frequencies, though, which I think, Regina, you can actually help me out, and we can discuss different things on that as well. So, Regina, how do you feel about your diagnosis last week?
It is true. I do have an autoimmune disease, so that is correct.
Yeah, and I think we really, that was the cause for most of the problems that I was seeing. That's why I stopped there with looking for other things because sometimes if you have an autoimmune disorder, you really need to nip that in the bud and seek out further assistance to diminish that, decrease the impact on your systems and your body, and also manage your symptoms as well. So, Regina, have you gone to a medical practitioner of sorts and have gotten some type of help?
Yes, I see a regular MD doctor, and I also was seeing a functional medicine doctor.
Nice, you have best of both worlds there. That's great. And if they do want to speak with me, I'm more than happy to speak with them about it. Uh, Also, um, do you give your permission to discuss things happening today, as far as what we're going to discuss regarding your medical situation? Do you grant permission for us to do that today on this show, and also have them be in future shows that are aired through the internet?
Yes.
Great. I just want to be sure, everybody wants to know these things. So, do you remember what I told you to do last week?
Yes, I did buy the pH strips, and I just received them last night, so I did my first one this morning. It was 6.75.
Okay, and have you done any baking soda or something to help raise your pH since then? Since last
Yes,
week?
yes, I do put
Oh,
a pinch or two in my coffee. Um, and
good.
yeah,
Yeah, coffee is really, I think we discussed that. Coffee is very acidic. So it really would help. And that's good. We do not have a baseline for Regina here because she started her treatment before she could take her pH level. Anyone can get those test strips, though, by the way. I go to pipingrock.com and I order them online. What do they cost? Like $7 or $8, Regina?
yes.
Yeah, so they're quite practical and reasonable with price. And you got it within the week, I'm assuming. So that's a good thing. Um, I'm just happy you started on that. I'm very happy you started on that. Um, it's just it makes me very, you know, uh ecstatic to think that, some people don't want to try some of the things, and it's sad. And, as I say on this show, and I say it off air, on air, it's like it takes a village to raise a child. It takes all different types of medicine on this planet, whether it be Eastern medicine, Western medicine, herbology. I do rainforest medicine, Native American medicine. I mean, list goes on and on. There's Tibetan healing, there's India, Ayurvedics. I mean, there's so many different things. And if you can combine those things, it's wonderful. Um, Not to say it's always the answer, but combining it when you find different things, it's fantastic. So today we will do, after we're done with Regina's secondary part two reading. We're going to do general purposes of frequencies and what is the purpose of sound frequency and which frequencies are the ones you're looking for specific symptoms. So this is something Regina could do, or any of our viewers can review it and see what's best for them. Remember, self-sustainability begins with yourself. It is your responsibility to find the medical practitioner or professional of any type that you feel you need. So I have another company called Sustainability Management Institute, and we do things for corporations, and it's all about sustainability. This is self-sustainability here. This is my journey. I'm a minister, and this is what I do through my ministry. And I use my medical background as well doing this, and it's wonderful. So how are you feeling now? Are you feeling okay about starting this?
Absolutely. I'm ready.
Okay, well, I did actually find much more for you. on your script and alternative type of things you can try and do and present to your practitioner and see which things that they approve or disapprove. It all depends on you guys, what you want to do. I don't force things down people's throats. So I don't force them down anyone's throat. And it is what it is. Does sound frequency sound like something that's interesting to you?
Yes, I have listened to some of them before, but I honestly can't remember which ones they were.
Right. And that's something too. I can always just snap a picture of your chart here. So you have a copy of that. And I can snap a picture of some handouts I have on sound frequencies that has different frequencies and what specifically they're for. So, perhaps you can go online, maybe even call up, good old internet. You can just go on there and ask it to please play frequency F sharp or whatever the frequency is. And maybe it'll just play that frequency, or they come up with videos that you can listen to that frequency. I love doing it. I do it for coffee house jazz all the time, when I'm cooking or something. And it's just so nice to pull things like that up. So I don't know if you do that, but I don't know. Anyways, though, I did want to say before we take our commercial break, I did notice quite a few things when I went back and I was looking at your photos. Ignoring the immunity portion, I went back to see and document some of these things that you need to hear about. So I'm really happy about that. So yeah, today is an interesting day. It's my birthday and I have my phone and it keeps going off. It's like, shush up, leave me alone. Not right now.
Happy
Well,
birthday.
thank you. It's been very hectic so far, but I think this evening I'm just going to sit down, relax, maybe watch some TV and veg out, perhaps. Or maybe I'll start a next week's script. Who knows? Well, I'm actually going to your photographs. And yeah, I did see quite a bit of little things. And I want to tell you, we'll even get a little bit into internal organs. So that's good. A lot of things up by your jaw, not just your thyroid. That there's what I mainly want to talk to you about when we get back from our commercial break. So, by the way, you've been watching Medical Intuitive Insights. I'm Dr. Gloria C. Warren. I am the host of this show. And we are going to take a quick commercial break. But when we come back, we're going to get into the little things and bigger things of Regina's symptoms of her immunity disorder. And that way there you get to know some of the other background of what can be contributing to the situation, as well as being annoying to her as symptoms that maybe that it will go away later, maybe they won't. We'll discuss that a little further. Don't go away. You're going to want to hear this. We'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Welcome back to Medical Intuitive Insights. Glad you could be here with us. Regina's back for part 2 of her reading. We're going to get more in depth outside of the immunity disorder we discussed last time. We are now going to discuss her second half of her reading, which is going to be more detailed and more discussion of symptoms as well. And then we'll go follow up and go into sound frequencies, the reasons for it, the causes of situations, and how frequencies can help specific symptoms that patient is having for many things. So are you ready, Regina?
Yes, I am. Thank you.
I know, it's like, I'm more than ready. You know, Regina, feel free on this part 2 to comment as we go along and we can discuss things. You are part of the show too, not just me. Okay?
Okay, thank you.
So I went in this is what I had been doing to try and give her more detailed information. There is quite a bit of situation up near her thyroid and from, I would say, from the heart chakra on up. There's quite a bit there. Thyroid enlarged, definitely. You probably already know that.
Yes.
And then, yeah, and then I'm seeing TMJ in the jawline.
I do grind my teeth, unfortunately.
I see the swelling in the jaw joints back in here. They're actually swollen up, and it's putting pressure on your lymph nodes. And we can get into the nitty-gritty if you want. I can tell you even which lymph nodes. I just need to look at your photograph again once more. Okay, let's see. Yeah, there's a lymph node right here in this little nook, like right there. I'm right on mine. That one there's swollen up on both sides. That's cutting off circulation to the lymph node. Your grinding of your teeth. Please try not to do that. I'll just put here, no grinding.
I do have a mouth guard that I wear.
Right, but you're still doing the pressure with your mouth, the grinding pressure. And when you do that, it flexes this muscle right in here. And when you flex this muscle, it cuts off some of the circulation. It lowers the circulation in this lymph node. Plus, you have a lymph node right back here, right back under your earlobe. If you go to your jaw and you go down a little and you push in there, it'll get tender from time to time, and that's from lack of circulation to that lymph node. That'll go on the reconciliation side. I want to do some reconciliation for you too. So, jaw, we're going to talk about red light. And then I was looking as well. Oh, I was looking at your arteries, your carotid arteries. There is some decreased circulation in your carotid arteries, but there's an auxiliary artery that goes, as your artery goes up, there's a tiny skinny one that goes down into your thyroid area. And that one there, the auxiliary it's actually got some blockage in it. I would say 30 to 45% blocked. It's it's so skinny, and it's hard to get that blockage out of there. But let me put that down. Carotid artery, and then I'll just put a dash. We'll talk about resolutions for that as well. Now I'm looking at your eyes and behind your eyes in the frontal cortex of your brain. I am seeing a lot of brainwave activity when you took those photographs. I don't know if you were extremely busy at the time or you're being analytical, or I think you're being over analytical at what you do in life, maybe your job or something, because though that whole area, it's capable of high analysis, and that's fine, but you have to give your brain a rest. So it causes a lot of overtension up in this area, and that can actually trigger the grinding of the teeth because you're not relaxing your brain, your jaws continuing during your sleep. It's interesting how the brain works. We may actually talk to one of our neurologists that's on our team. I think that would be an interesting topic for our viewers one day, maybe perhaps tension and psychoneuroimmunology and how that works in conjunction with each other. I think that would be a wonderful topic. Does that sound like something you would listen to?
Yeah, absolutely.
Yeah, how your immunity reacts to your psyche, of which it could be caused from your tension and brainwave activity. And he's the expert. She's amazing. One of my loves of life. I love neurology, but she's the best. So let's see. The analytical, the thyroid. Yeah, whenever you have any pressure, added pressure in your body, your blood cells, if your pH is low, I would say below 6.6, it's going to attack your own cells. So it could be in a joint or anything. I do have the photographs from before, so keep in mind that that's what I'm going by from before you started adding baking soda to your coffee and things like that. So what I'm seeing here is, okay, your right wrist. This is where I'm seeing your body is attacking some of it. Your left wrist area has decreased circulation. Let me double check your feet here. The artery splits into 3 as it goes down from your ankle down into your feet. And I see some swelling, but very little. I'm not as concerned about that. It's more, I marked the left knee. So I saw I guess I'll go to the full body photograph here. Yeah, I saw the swelling in the left knee, the meniscus in between the joint, the upper joint and the lower part of the knee joint there's like a gelatinous fibrous tissue in there to protect the bones, and it lubricates the knee as well. That's gotten thinner, and I've seen some swelling, especially on the inside of the knee. Do you get knee pain at all?
No.
Well, that's good to know. I do think you got a stripe on your pants that goes right across here. So I'm like, I do think this I think, yeah, this is going to become a problem if you don't do something about it. It's mostly the left knee. The right knee is closer too, but the left knee, you're already starting to get a little fluid in there. I'm going to put low-level fluid in knee joint.
Is exercise good for that or not good for that?
You need exercise to keep your muscle tone up, to help protect your knees. So this is something else I do. I'm a certified health coach, and I can tell people different exercises. Why don't we put that on our reconciliation list? And that would be knee exercise. They're very specific with that because you don't want to hurt the joint, but you want to get exercise to the muscle. So knee exercises.
Yeah, because I do different types of workout.
Yeah, well, you have to protect that really. And so if you're getting it in the left knee, chances are within a couple of years you'll have it in the right knee. So you need to start doing the correct exercises and just apply them to both.
Okay.
So what I'm seeing when I say the wrist, especially the right, and then the knee, the left was low level circulation. coming down the forearm of the left arm and into the hand somewhat. Let me double check your hand. I'd like to just go into a little bit of the internal organs then. It's not showing up on that picture, but it shows up on the other one. It's a little low level circulation under your left breast. I'll just do a shading area. I already marked it. And we talked a little about self-hypnosis. I don't know if you really, I mean, it does help with symptoms, but I don't know if you're really in a lot of pain. I don't see extreme pain. I do see some tenderness sometimes.
I do get back pain. Really, that's the thing that hurts the most is my back, but I do a lot of lifting at work. So
yeah. Okay, so you do have scoliosis in your back. And what I'm going to do is the mannequin here faces forward, but I'm looking at the picture of your back. So I just have to reverse it. So let's do this. The top part of your spine leans to your left. So let's lean that to the cervical, the thoracic spine. The bottom leans to your right. Oh, but it's interesting the way it leans. It's like a slow lean. And I see the vertebrae you have a little osteoporosis in those vertebrae in your lumbar spine. But I'm seeing there's also pain in your thoracic. A little bit, I'll indicate. It's kind of like between the, what I tell people are the wings.
yes.
That's from being on a computer too long, sitting at a desk too long. That there you can get rid of it. So the lumbar spine, it's crooked. It's creating pain across there. I'll mark it down. Pain, scoliosis. As far as the degree of scoliosis, I'm seeing about a 20%. You have it going both ways. And then your neck is another story. I can't see that in the other one. So if I look from the front, let me see if I can go through. Now this is reversed. So yes, your neck is actually leaning to the left. No, wait, let me look at that one more time. Okay. I exaggerated these curves on this picture just so you can see. Push there, push there. So how are you getting left to right to left? Yeah, you're going like this pretty much in the whole scenario. Not good. And we are looking at taking another commercial break. Let's wait another minute. And I just gotta that's all right. Let's take a second commercial break. We will be right back. We're going to talk to her about her symptoms and what can be done about them, and maybe get a little bit more again into her internal organs. Okay, so we're going to take that second break, and you're watching Medical Intuitive Insights. I'm your host, Dr. Gloria C. Warren. Don't go away. You're not going to want to miss the frequency symptom chart that I'm going to give her. I'll be right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back. You're watching Medical Intuitive Insights. I'm your host, Dr. Gloria Warren, and we have our patient for part 2, and it's Regina. She wanted a more in-depth look at her symptoms, her illness. She has an autoimmune disorder. She has been working on it, though, and her pH level we believe it's come up. We don't have a baseline, but I'm pretty sure every time I see a baseline, I'm usually right on target. So, Regina, how are you feeling so far? Do you agree with your reading at this point?
Yes, I do, and thank you.
You're welcome. So I just wanted to get into her internal organs before we move on to sound frequency healing. So I'm looking pancreas. Pancreas is, it's swollen. Let me go back to that photograph. Sorry, I just don't want to misstate. Okay, I'm going to have to use the one from the back. That's okay. And it's, the pancreas is swollen. Blood sugar. Let me get to the blood sugar. It's not bad in these photographs. I do see some blood sugar raised. I would say 130. Not extreme or anything, but in it's a pre-diabetic situation. Yes, I do see that problem we discussed during the break. Left hand, obvious. That makes perfect sense. And I did put low-level circulation in there. So it all ties into previous condition that Regina had. But she doesn't have it now, and her body is compensating much better, which is great. And, pancreas, swollen. Her blood sugar was 130 when she took these pictures, which was September 4th. With what she is doing with her putting little baking soda into her coffee in the morning, it's her pH level is around, what was it, 6.6?
6.75.
Amazing. Absolutely amazing. This is fantastic because it's going to help get more circulation where she needs it. Your left hand and your right hand, but the left hand's a lot worse. You have the swollen joint, base of the thumb. I'm seeing the body has done some damage to the inner joints of the knee, especially the left knee, and with the wrist, but not as bad. I'm seeing that jaw, of course, having problems in the photographs. Hopefully that's getting better. I think, though, you do need some kind of, just a few phrases to say to yourself before bed. A self-hypnosis phrase would be great. And maybe we can discuss some sound frequency regarding that. So, is there anything in particular other than that you wanted me to look at?
The only thing is, for over 30 years, I have problems sleeping.
Yeah, that's that frontal cortex of your brain. The brainwave activity is so very high. Jaw, I mentioned red light laser. It would be 650 to 665 nm. They've taken most of that off the internet recently. So they know, research has shown that it increases circulation up to 2 inches into the skin, and even further sometimes. So that particular frequency, if you find somebody that does that red light laser therapy and they have that particular frequency, or you can request that one, it would really benefit you. I can talk to you more about that after our phone call. The carotid artery in your neck, it's right side, slight left, but you wanted niacin, 50 milligrams. Now, here's the thing about niacin. They sell niacin 100 milligrams, 500 milligrams. The thing is those don't give you the flush. The flush is part of the therapy that clears out your arteries. So you need that flush for it to be most effective. The other thing is you don't want too much of a flush. So you get a 100. I have a picture. I'll send you a picture. Send niacin pick. The specific one I use, it cleans out my arteries. I had a clogged artery. It's gone now. I'm fine. But doesn't always work. But I think in your case, it's a good thing to try. Knee exercises. Okay, so you can keep exercising. No running, no hardcore walking. What my thing is you do leg lifts. But sometimes you can get a leg lift machine where you're lifting your knees up like this, right?
Yes,
Sure, you've seen it. High repetition, low weights. But then the ones you can turn your body over on and then lift them up this way, there's a separate one. Those machines are a little harder to find. I picked one up on Facebook Marketplace. I mean, easy peasy, right? And it's like new. And that'll keep your muscles tone, and it won't be impacting your knee joints. It'll actually tone the muscles around your knee joints to help support them better in the future. So 3 times a week, I would say 3 times a week. So I'll say knee bench, low weight, and then high repetition.
Okay.
And you build to it. And then if you want to build some of the weight once your muscles, like a month later, you want to build, just put another couple pounds on or something, go ahead. But do it slowly because you don't want to injure those joints. They're very delicate right now.
Yeah, I've been using the weights on that. The front one, not the one that you lay down and do the back ones.
Mm-hmm. So pancreas, as well as your blood sugars and things of that nature. I think it's so minor, but you want an anti-inflammatory, like 1,200 milligrams turmeric. Make sure it's a very clean turmeric, no heavy metals. Okay. I think I do something force or whatever. I can take a picture of that too. Niacin pick, turmeric. I also, there's something for joints that you could take through Optimal Health Systems. I could send you a link to your email, and I'll find it in there and I'll send it to you, and you do what you want with that, but it'll be there for you to decide. Okay. So also pancreas, go ahead.
I've been told I have osteoporosis also, so I'm taking calcium with vitamin K. Should I still be taking that? I mean,
no calcium carbonate. You want to check if you want to check it, you go right ahead. And that includes oyster shell calcium.
Yeah, I'll have to look at the ingredients. It's just bone restore.
Yeah, you need the actual ingredients because calcium carbonate has been known through research. They found that it actually ends up in your arteries, not in the bone. So yeah, that's no Tums either.
No, I don't do that.
I don't mean that name brand. Any of the tablet form type of things for your stomach or whatever. I'm a little concerned about your pancreas. That's something that needs to be revisited in a few months. It could be a parasitic situation, but it can be cleared out as well. So it's nothing to worry about, just something to keep track of. If you notice your blood sugars start to go up, give me a call. Okay. And that's about it for that. Let's go into frequencies now. So sound frequency, it's sound frequencies are specific vibrations and tones that you can hear to restore balance, harmony, mind, body, and spirit. 5 main purposes for physical restoration: emotional balance, mental clarity, energetic alignment, and spiritual connection. This would be good for you, though, Regina, because between the mental clarity and energetic alignment, you can actually do things to help you sleep. So it really pays off when it comes to that. It really does. I love it. Wish I could do more of it, but we'll see. And then so I can go into it can, for physical restoration, can stimulate cellular repair and regeneration and help relieve pain and tension, support circulation, immune function. Emotional balance, it can calm your nerves, reduce stress, anxiety, depression, which we're all going to need over the winter time. Releases stored trauma and emotional blockages, which is more common than people realize sometimes. Mental clarity enhances focus, memory, creativity. You can be very focused. We have to get you so you can relax that focus and go in the other direction to relax through meditation and things of that nature. Energetic alignment balances chakras, subtle energy systems, clears stagnant or blocked energy, and strengthens the flow of life force. I'm looking at your energy problems are from here up, and I think maybe that heart chakra is a little bit blocked. And if we can get that flow up and down, that's something to consider. You can lay down, you can do chakra breathing, and that's breathing in and out through your crown chakra. In, deep breath, count to like 5, relax, let it all out. You do like 3 of them, 5 of them, whatever you're comfortable with. And then you go to your third eye, and you go to your boy chakra. I do the neck for that a lot of times. And then you go to your heart chakra. So you maybe get this to flow better, and you can keep going down to get it to flow even better. And that actually will help with your mental relaxation. So it really works, that type of thing. I do that for myself when I can't sleep. Spiritual connection. It promotes peace, stillness. It can be used a routine like an instrument to bring harmony to your body and self. So let me talk to you. What are your symptoms?
Regarding this sleep or just overall general?
Overall in general.
I do at work, sometimes my heart rate will go up high. I don't feel it though. It could be in the 130s. But I don't feel it. I've had workup done on that. They said it's nothing to worry about, no medications. I just get sometimes a run of SVT, but they say it's okay. Honestly, I feel pretty good. I'm not mornings are very hard for me to get moving after I've worked the day before. But then once I get moving, then I'm good. The only thing like pain is my back, and that's usually after working. So I try to protect my back. I don't want to hurt it.
Okay, so pain relief and stress is 174 hertz. So it's also called the analgesic frequency, and especially known to relieve lower back pain. So you can call that up. I marked it on your paper, so you'll have it. You can call that up on the internet and play a video with that, or just an audio, whatever you decide. But you may even want to put it on your phone, so you have it. And then you have a high anxiety type of thing, and I think it is brought on by your work environment. Excuse me. Thank you. So with high anxiety, 432 hertz, and it's a natural tuning. It induces calmness and deep relaxation. You can do that anywhere. It's not going to just put you to sleep. I mean, you can use it at night before bed too, but it will just relax you and mellow you out. But sleep disorder specifically is a 963 hertz. Migraines, sleep disorder, it stimulates the pineal gland, helps with insomnia and headaches and things of that nature, chronic fatigue during the day. In the morning, 852 hertz. It improves focus, intuition, and mental clarity. That's probably maybe something in your kitchen as you're making coffee you can listen to. It's a shame we can't have little things in each room. We're going to continue on with that when we get back. We're going to take a commercial break. You're here watching Medical Intuitive Insights with me, Dr. Gloria C. Warren, and Regina, and you won't want to miss the last quarter. Stay right there. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back to Medical Intuitive Insights. I'm your host, Dr. Gloria C. Warren. We are here today with Regina, and we just discussed some sound frequency healing. And I'm sure everybody could, note this and put it up on their wall or have it around. So in case anyone in their family needs some of this information, they can have it. But either way, the sound frequency things. And Regina, you're still with me?
Yes, I am.
Yay. Sound frequency it's specific sound frequencies that the body is encouraged to realign itself to a state of balance and wellness. And it can also be used for specific types of symptoms, such as pain or trauma or depression. Pain is 174 hertz. That is one I believe Regina is going to use, as well as brain fog, 852 hertz. And then we have sleep disorder, which comes up as 963 hertz. Just remember, if you're trying to get energy, you don't want to play a hertz a sound frequency that's going to relax you. And if you are trying to relax, you don't want to play something that's going to give you energy. So these are things that, it pays to know which frequencies are for which symptom. There's some for wound healing, Alzheimer's, dementia, brain stimulation, anxiety, insomnia, DNA repair, heart stress issues. The list goes on and on. There's different frequencies, pain relief, stress. There's also another pain relief, by the way. All right, well, I'll get to that. DNA repair, stress, heart, anxiety, chronic fatigue, brain fog, detox, infection. Got an infection, 741 hertz. So I will be sending this off to Regina with her other notes when we're finished with our session. And I think we went through quite a bit, actually. I want you to keep doing your pH test strips, at least every few days, and just make sure it still keeps coming up I know now they're saying 7.2 to 7.35 or something. That's too high. That's too high. You know, you start to get up higher, then you have a risk of getting alkalosis and depression and things of that nature. I don't like that. I like it from my personal experience. I like my pH to be between 7.0 and 7.2. And even when I do something like this, I actually allow my pH to drop down lower because it increases mental acuity and synaptic response so I can think faster. Yeah, there's reasons for all of it, but it can be hard on your kidneys if you have a very low pH for a long period of time. It affects your adrenaline and your kidneys. So, you know, there's good and bad in everything, but you just need to have balance in life. So we got to keep balance. All right. Well, I'm your host, Dr. Gloria C. Warren, and we have gone through our show today. So let me finish up here. Regina, do you have any questions about your reading?
I don't think so. We covered a lot of stuff, so thank you.
Oh, sure. I'm glad we did. I think you needed it. I owed that to you. I shouldn't stop too short like that. I mean, I got my point across, but at the same time, it's nice that you have the rest as well. So if we are looking for inviting a few open-hearted people, please send me a text if you'd like to be on the show. You can show your face or not show your face. You can use another name or not use another name. It's up to you. 715-892-7500. We also are looking for some experts in unusual holistic practices. It would be nice to get some ancient practices in the show. So our next Life Connect retreat is in December. Topic is youth regeneration. Learn about the latest scientific research, something that is not in one place now. This is extensive scientific research along with extensive holistic practices, even going into ancient medicine. We talk products, we talk approaches, we talk people, you know, physicians, the specific physicians that do things, the research studies themselves. There is so much involved, and it's going to be in beautiful Caribbean, the Mayan Riviera, and you know, beautiful setting where you can actually consult with a physician if you like. Nothing's pushed on you, but it gives you your options. So a lot of anti-aging surgeries are done down there, but we also do the holistic down there. It's fantastic. I would love to have you come. So morning yoga, morning walks on the beach. I believe Svetlana Pritzker is going to be doing walks on the beach every morning, as well as some of the discussions. So on energetics with people. You'll get 2 trainings a day from me. And it also includes most of your food. Breakfast, brunch, lunch, snacks, healthy. Everything's healthy, but you get to pick and choose what you like. So Medical Intuitive Insights is found on medicalintuitivegloria.org, as well as my old site, medicalintuitivegloria.com. You can see a video on that site as well from quite some years ago, but it's a welcome to watch for some people. It explains a lot, simplifies it too, so everyone can get the gist of things. So it has been such a pleasure to have you, Regina. Thank you so much. I'm so glad you could be on my show today, or on the public show, obviously. And I will send off all your information when we're finished. And there for the grace of God go I, and God bless all of our viewers. Please pass on this video to anyone who needs it. Give us thumbs up, comments. I'll try to answer comments as much as possible, and ideas for shows too, if you have any. Talk to you soon. See you next week. God bless.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.